I started to work with this immunotherapy. It's about 2 years now, will be. So I'm very pleased to do this because my thinking was very close to medical thinking, so more holistic, because I have done before shiatsu and other educations, so I was never looking only for skeletal or muscle disorders, but I was always looking a whole person, and also from the psychological point of view. These patches just fill in, and I'm very pleased, and I do a lot. I use a lot this tool. And what about you?
Yes, I'm also extremely happy to have met you all, and also the therapy. I think it's an amazing tool that now we have with us to keep working and to keep helping people. As a physiotherapist, I think my whole career has changed, because now it's much easier to help the patient. It's also we get deeper into the therapy. We are not only looking in a musculoskeletal condition of the patient. We go through other issues that may be causing this barrier that it's not allowing the patient to heal itself. So I think it's an amazing tool that I'm really glad that I had the chance to get.
I'm looking forward also to teach this immunotherapy. I think it's a big future, just started.
So, and as soon as we can involve other therapists to this immunoneurofrequency therapy, so easier it's going to be for the patients all over the world to get the therapy. So we're really looking forward to meet and to show this therapy to other physios or other therapists and doctors. And so we are really looking forward to instruct them, and also to make other instructors in our regions. I'm really looking forward to go to Spain and then talk to my colleagues and to make them closer to this therapy, so they can also spread in other regions around Spain or Portugal or any other countries around. This from a sport rehab point of view, I think this is going to change a lot. It's going to make the athletes perform better. We are not talking now only about sport injuries, that the rehab time will be much shorter. We are talking also about the performance of the athlete in every single sport. It might be running, swimming, football, or any kind of team sport that we can help them to reach the goal.
I didn't have many problems, but my colleagues do integrate this in the clinic, because in a way it's a big investment, because you have to invest in yourself to go to do all these courses, and then you have to buy these patches. So it is investment, and I was at the point I could afford it. But there's a lot of colleagues of mine, they don't see, or they are not sure what to do, how to do it. So I support them. Yeah, this kind of therapy, it's very good for us as a physio, because this disc works for 3 days. So you don't have to see the client every day, and you can follow up with them, or they can change these patches at home. So it's really very useful tool for us and for the patients. So I changed a little bit. I am not seeing patients every day, or I can see them once a week, which is easier for me and for them.
When we start applying the disc, in our patient. It might be a little bit confusing at the beginning when after starting with level 1 and 2 to make the protocol. You need to think a little bit more on that, what you want to achieve with the protocol. But then after, with time, when you are working with the disc, with the amino disc, then it gets easier. So it just after 72 hours you can see the patient again, or you can just give them some discs so they can change at home. So it's a very handy tool. It's very useful tool. It's usually a sport physiotherapist. We need to go with the team. We need to travel with them, and this is amazing that you don't need to carry with the other machines anymore. You just need your bag with this all full of amino disc, and then you can apply. Then if you're in the training, if you're in the match, in between the first and the second, the half of the match, so it's quite handy. It's very useful for that we can carry them all over the world and use them at any time, at any moment. And every time that I'm with you, with all the team, is really amazing, because at the end, after the second or the third day, we become a family. We really enjoy to be with all the therapists that started learning this, or all the therapists that they are already here for so long, and really sharing all the knowledge. All of us is providing with something that they have in the backpack, and we really like to be here and to continue in the academy. It's something amazing.